For most kids across the state, it's back to school week, and probably the most highly anticipated back to school week in any of our lifetimes. Most districts are returning kids to classrooms under a hybrid model with some in-person learning and some remote, but already some are pulling back. Just today, Dover-Sherborne switched from its hybrid plan to fully remote to start the year after as many as 150 students went to a party over the weekend where social distancing rules apparently did not apply. Lincoln-Sudbury made the same move over the weekend after dozens of maskless students attended a party Friday night. And Dedham voted last week to delay its in-person start due to a sudden recent increase in coronavirus cases there. But for others, it's back to business as normal, well, the new normal. Of course, it's uncharted territory for everyone, finger-crossing time. But when it comes to higher ed, we're already getting some early indicators, and local officials are sounding the alarm about one school in particular, Boston College. The school has had 104 people test positive for COVID-19 since the start of their year. 67 of them came in the past week alone. And many of the cases, according to a spokesperson, are linked to an off-campus gathering where students watched a basketball game without masks or social distancing. As of this weekend, 82 students are in isolation and 22 have recovered from the virus, but others in the community are growing concern. And officials from Newton and Boston have asked BC to take several steps to get things under control, including increasing testing for all students to 1 to 2 times per week and de-densifying, a coronavirus-era word, meaning sending some students home so they're not so crowded together. But while BC officials say they're open to more testing and working with local officials on contact tracing, they say they have no intentions of sending any students home. I'm joined now by Dr. Sandra Nelson. She's an infectious disease physician at Mass General Hospital, assistant professor of medicine at Harvard Medical School, who's been helping to guide the Baker administration in school opening plans. Dr. Michael Siegel is professor at the BU School of Public Health. Gentlemen and lady, thank you so much for joining me. I really appreciate it.
Thank you.
Thanks for having us.
Can we start on the higher ed level and then we'll work our way down? Dr. Siegel, you wrote a rather scathing condemnation of your school for being a hybrid, essentially arguing they're ignoring public health at the BU School of Public Health and urging them to go 100% online. You're suggesting this is all about the bottom line for your school?
Well, this decision was actually made in April. In the end of April, the school decided to go online. So there's no way they would have any idea back in April what the situation would be in the fall. So clearly they were doing this for financial reasons. They didn't want to lose students who might go to other schools or might defer. There's no question in my mind that the school is putting its financial status above public health concerns.
You make the point that the other two graduate schools of public health, Harvard and Tufts, are online. So should your guiding principle that public health should determine all, should that not advise the leaders of Boston College that it's time to go all online as well? Unlike BU, they actually have cases, scores of them.
Absolutely. I mean, I think that I would have said that BU shouldn't have online classes, or should have online classes even before there were any cases or testing. And now at BC, you've got over 100 cases. I think it's absolutely time to switch to an online system. What people don't realize is that the number of cases today, what it's telling us about is not what's happening right now. It's telling us what's going to happen 2 to 4 weeks, even 6 to 8 weeks from now. And so that's what I'm afraid of. I'm not afraid of 102 cases. I'm afraid of what's going to happen with those 102 cases 4 weeks from now.
Dr. Nelson, do you have different advice for Boston College if they were to seek it?
You know, I really share those concerns. I think that the 104 cases may just be the tip of the iceberg. Unlike some of the other local schools, local colleges and universities, they don't have a rigorous testing program. Some of the other institutions have been testing all students once or twice a week. But at BC, that's not been the case, and it makes it such that we don't really understand how extensive this outbreak is. It may be quite a bit worse than what we understand at this time.
Considering what you both do for a living, when you read or see that it appears to be easier for an athlete to get a coronavirus test than a professor or a graduate student instructor? Starting with you, Dr. Nelson, does that not put you right over the edge? It does me, I should say.
You know, clearly there is a difference in access to tests, and this has been true really from the beginning. And it's not just athletes versus professors. It's, you know, those with means and resources versus those that don't have means and resources.
Yeah.
But I do think that testing, if it were done more frequently, could really enable a safer return to school. You know, I'd also like to highlight that it may not actually be the school that's the problem. It's the off-campus gatherings. And it's really the congregation of all of these people together that is really flaring this epidemic.
Do you agree with that, Dr. Siegel?
Well, I definitely agree that there needs to be more testing, and that there just is not adequate testing right now. Even at BU, which has probably the best testing of any school, our graduate students are still being tested only once a week. And to me, I think what the biggest shame here is that the testing is being used for something that's not necessary. I mean, our students don't need to be in person. And this testing, these amazing facilities, could be used to actually test people in the community who need it. Dr. Nelson mentioned that, it might be easier for a football player to get tested than somebody else, but it's even worse than that, because our students can get tested much easier than somebody in the community who actually has symptoms.
Yeah, Dr. Nelson, let me go back to you. I met you about the time that you were intimately involved in the advising of the Baker administration and Jeff Riley, the Commissioner of Education, about going back. This is K through 12, obviously. Roughly, according to the governor, 70% of our K through 12s are hybrid, 30% are mostly online. Only a couple are all in person. When you hear about problems like Lincoln Sudbury and Dover Sherborne, do you say to yourself, these are outliers and the schools did the right thing, but they're isolated, and what works for them should not necessarily be applied to places that are playing by the rules?
You know, I think the challenge is that, there is, particularly for older children, it's human nature to want to congregate. And
exactly.
I think we're trying to really restrict what is fundamentally human nature. And I think this points to some of what we've talked about in the past, that it's really, the school potentially can be a safe place, but it's what's going on in the community which is going to drive the risk to the school. And so I do worry about these potentially being signals of problems if they can't be controlled in terms of the gathering. But I think it's going to be really difficult. Our children, our adolescents, and our young adults are really they're really social beings, and trying to restrict that is very, very difficult.
But am I not right that earlier on you were all on board this notion that, at least other than in the so-called red zones, with our positivity rate as low as it is across most of the state, not all of the state, you were all in for kids going back to in-classroom learning, at least part-time in K through 12. Have you changed your position?
No, I don't think I have. I think that I'm still very much in favor of in-person learning, particularly for the huge advantages that are offered to students with in-person learning. But I do think, as you pointed out, there is some sensitivity to it, and the rate of disease in the community is incredibly important, as is our ability to mitigate that disease in the school setting. But what's going on outside of school, I think, has always been a great concern in terms of whether or not we'll be able to open those schools safely.
Dr. Siegel, what should we be doing in K through 12?
I think that we should be putting the priority on the youngest kids. I mean, I think we should be doing everything we can to get the elementary kids and the middle school kids back. And to do that, I think we're going to need to sacrifice something. And what I think we need to sacrifice is the high school and the college students, because there's just no way you can do it all. We can't have this everybody going back at the same time. The other thing is, you can't control high school kids and college kids, and we've seen that. And I don't think we can blame the students, to be honest. I mean, obviously they shouldn't be partying, but they're going to do that. That's what high school students do. That's what college students do. And we need to factor that into the decision. In other words, when you're making a public health decision, you can't make it in an ideal world and say, what should we do, assuming that everybody acts perfectly. You have to decide, what should we do, given that we know the way people are going to act, and knowing the way that undergraduates and high school students are not going to social distance, for an entire semester. I think that is really a mistake. And I think we should have put all our efforts on getting these young kids, kindergarten through, maybe 8th grade, to get them into the classroom.
Dr. Nelson, I have to say I couldn't get into medical school, but I agree with Dr. Siegel completely. That's not the direction the state went. Some individual districts, Boston's a good example, is a variation of what Dr. Siegel said. They're starting with the youngest grades and I think special needs kids, and then maybe a little more quickly than Dr. Siegel might like, they're working their way up the chain. Wouldn't that have been wouldn't it still be a saner way for the state to proceed than the way we are?
So I think, the decisions that you mentioned, these are made at local levels. I do think that there is an advantage to in-person learning for the older students as well. I do think that as long as the disease in the community is controlled, that we can put the mitigation strategies in place in the schools to make it safe. And I think, again, it's not so much what is happening at the schools, it's what's happening outside of the schools. And
right.
Going from an in-person school to a remote school doesn't really change what's going on Friday and Saturday night. And I think I worry more about what the kids are doing outside of the school than what's happening in school.
What do you do about that? I think you make a very compelling point. What do you do about that? Kids will, let me be as trite as one can be. Kids will be kids despite the warnings that are given them by people like you and their school leaders. What do you do about that, Dr. Nelson?
I wish that I had a great answer to that. I don't. I have kids that have been known to do things that they shouldn't be doing. That's part of growing up. I do think it's incumbent upon all of us to remind each other that this is a community. I think what we've seen in Dover, Sherburne, and Lincoln Sudbury is that, the actions of a few really had an impact on the community at large. And so just being aware that the steps that we are taking are really going to potentially impact our friends and our family and our friends' families, and really trying to reinforce sort of the altruistic motivation of doing the right thing.
Dr. Sandra Nelson, Dr. Michael Siegel, thank you both so much for your thoughts. I appreciate it.
Thank you.
Thank you for having us.